Do you know that the average age to start your family or have your first baby in the United States has increased by 2 years in the last couple of decades? People are starting their family around age 27 or even later, especially if you live in New York or San Francisco or some of the bigger cities. People are starting their family in their 30s. If this is you and you want to learn more, stick around to learn all about maximizing your fertility in your 30s. I'm Dr. Laura Shaheen. I'm a double board certified OBGYN and reproductive endocrinologist, helping people grow their families for 20 years, and I love educating. If this is your first time finding this channel, welcome, subscribe so you get my weekly videos all about reproductive health. 2 more ways to stay in touch. Number 1, my newsletter, link in the description below. Weekly newsletter with fertility in the news, educational content that I've created that week, and recommendations from products and books that I love. Second way, my podcast, the Baby or Bust Fertility Podcast. You can listen anywhere you listen to podcasts, weekly interviews and in-depth discussions on all things fertility and reproductive health. Today, we're going to learn all about fertility in your 30s. You may be afraid of age 35. It feels like everywhere education is like, oh, you're turn 35 and all of a sudden your eggs shrivel up and you're just going to have a hard time with fertility. Well, that is not true for everyone. Or when you're pregnant and you're 35 years or older, you get labeled as a geriatric pregnancy. And that just has to stop. That is just a medical term. And I think it's awful. And I don't like using that term. But there is something about age 35 where does seem to take longer to get pregnant. Miscarriage rates go up a little bit, and some complications in pregnancy could be a little bit higher. And that's why people pay attention more. But I really want to reassure you that a lot of people get pregnant without intervention or without treatment in their 30s. And it doesn't mean that if you're starting your family in your 30s, that you're going to struggle. But I think it's important to learn a lot about aging and fertility and just be proactive. Maybe think about testing a little bit, maybe think about getting a consult, think about your family goals. Today, we're going to talk about the reality of fertility in your 30s and some incredible tips that I think will really help you. In this video, we're going to go over 5 main topics. Topic number 1, we've got to review and understand the impact of age and fertility. Topic number 2, know your family goals. It's important to know as soon as you can what your family is going to look like or what you want it to look like, because that might really dictate your next steps when you're thinking about fertility in your 30s. Topic number 3, know your risks for infertility. There are things to look out for and reasons to get testing and have a consult sooner rather than later. Topic number 4, fertility testing. What to test, when to test, and how to think about when to ask more questions. And finally, topic number 5, some tips on getting pregnant as soon as possible, understanding your cycle, when to try. I want you to understand the basics. Stick around to the end of the video where I talk about the option of using IVF as a strategy for building your family. Not everybody needs IVF to have their family, but it's really important to know about this option so that you can make a decision that's right for you. Topic number 1, age and fertility. Why do people talk about age and fertility so much? Because it really does matter. And there's an impact of age on female fertility or the person with eggs, and there's an age factor on men and fertility or the person with sperm. It's more dramatic with eggs because those eggs are sitting in our bodies since we're born. They're frozen in a genetic state where they've got 2 copies of each chromosome, which tells all of our genetic content. And it's when we ovulate, whether we're 35 or 25, when our eggs have to do all of their genetic work. They have to get rid of that chromosome in order to fertilize with a sperm that is carrying its chromosomes. So the longer the eggs are sitting in our body, the more of them make genetic mistakes. When someone gets pregnant at 25 and has a beautiful baby, we're like, great, we're celebrating, absolutely amazing. When someone gets pregnant at 45 and has a beautiful baby, we're like, wow, that's amazing. That is unusual. You kind of know that. You know that miscarriages go up as we get into our 40s. It takes longer to conceive. That all comes back to, I mean, there's many factors, of course, but a lot of it comes back to we only ovulate 1 egg each cycle. We only have 12 tries in a year. And just statistically, as those eggs age, fewer and fewer of them are able to do all the work to become a healthy baby. Now, there is a male impact of age and fertility. It's just not as dramatic, but over the age of 45, certainly over the age of 50, there's lower sperm counts, lower motility, and taking longer to conceive. What's different biologically is that men make sperm every single day, and when it's made, it's ready to go. So it's not that sperm have been sitting around in our bodies since we were born, kind of being exposed to all the things that make it just as age a lot of things change with our health. So fertility for men and women is different. Here is a graph showing the monthly fertility rate if you're just looking at the age of the woman or the person with eggs that's getting pregnant. And you can start to see a dramatic drop in the chances each month that that person is going to get pregnant around age 35 and kind of much lower around age 40. For men, that drop off doesn't start to happen until age 45 and even lower after age 50. So there is that difference, and now you understand why. Another graph or image that I want to show you is that it's not just about getting pregnant or having a positive pregnancy test. It's about having a baby, the baby that you so desire, because it's important to realize that not only does it take longer to get pregnant as we age, but the miscarriage rate goes up dramatically. And it all comes back to those genetics and those chromosomes working correctly. And so this is an image showing the chances of spontaneous abortions. An abortion is another word for miscarriage, just means a pregnancy that stops developing. So miscarriage rates go up dramatically as the age of the person with the eggs increases as well. So just want to make sure you realize it's not only chances of getting pregnant, but it's also chances of miscarriage that change with age. So now that you understand the numbers, take a big breath, because there are still hopefully lots of wonderful eggs and chances of getting pregnant without intervention, and not having a miscarriage in your 30s. But I just want you to understand why you've learned about the biological clock, or why people talk about age and fertility, and why it's a little bit different between eggs and sperm. Topic number 2, know your family goals. So when I say know your family goals, I really mean, of course, this can change, but if you want to have 2 or 3 children and you're starting your family in your 30s, you should really consider, at least at a minimum, getting testing sooner rather than later to make sure you're not missing anything that could impact your fertility and lengthen the time to your first child. Because I'm not so worried about the ability to have a child in your 30s. It's just that when you want to try again, you're typically about minimum 2 years older, and those eggs are 2 years older. So if you think about it, you get pregnant, you're pregnant for a year, and you don't usually try again until the baby is about a year. So your body can fully recover and you're ready to get pregnant again. And it can be more challenging to have another child or a third child as you get into your later 30s and even early 40s. And so I think that's a really important thing to understand and help you think through what your next steps are going to be based on what your family goals are. Topic number 3, risks for infertility. This is important to realize and think about. So think about this checklist. And if anything that I say here resonates with you, I would get a preconception visit and get fertility testing sooner rather than later. There's 5 things that I think about that put somebody at an increased risk of infertility. I'm sure that you can think of more, but these are 5 red flags for me. Red flag number 1, a chronic medical condition, something like diabetes or thyroid disease. Now, if these are treated and well controlled, then your fertility is probably going to be similar to other people in your age range that don't have the condition. But having a chronic medical condition can impact your reproductive health. So I think about getting testing sooner. And I think about having a great checkup with the doctor that's managing your chronic condition, whether it's asthma, diabetes, a hormone condition, so that you really are optimizing your overall health. That will only help your reproductive health. Red flag number 2, a history of infertility. If it took you more than 6 months, more than a year to conceive and have your first baby, or your second baby, and you're adding to your family, you're going to be at a higher risk of struggling again. That doesn't mean that you automatically have to go get testing or you have to assume or worry. But if you have a history of infertility, then you want to be very thoughtful and maybe get testing sooner rather than later. Red flag number 3, some gynecologic conditions that are also associated with infertility. If you have a history of endometriosis, polycystic ovarian syndrome, and fibroids, then I would recommend that you get testing sooner rather than later. There are lots of people that have endometriosis, polycystic ovarian syndrome, fibroids. Sometimes they have all three and they conceive very easily, and that is fantastic. But all of these conditions can be associated with infertility, and I think it makes a lot of sense to make sure that you're not missing anything sooner in your journey. Red flag number 4, risk of tubal disease. So people can have blocked fallopian tubes and have no symptoms whatsoever. The tubes are just the way that the egg comes from the ovary and meets the sperm. The tube is where fertilization happens and the embryo grows for the first 5 or 6 days. And then it comes down and implants into the uterus. And people can have blocked fallopian tubes and have regular periods. No pain. They can have no signs. But if you have risk factors for tubal disease, then I recommend getting testing sooner rather than later. What are those risk factors? I think of 3. Number 1, a history of sexually transmitted infections, things like chlamydia, gonorrhea, things that you could have been treated and caught really early, but there's always a chance that that could impact tubal function. Risk factor number 2, a history of an ectopic pregnancy. An ectopic pregnancy is one that implants in the fallopian tube. It can actually implant other places in the body, but it's most often in the fallopian tube. And if you have a history of ectopic pregnancy, that means you have a higher risk of tubal factor infertility. So it's something to think about. And risk factor number 3, a history of abdominal or pelvic surgery in the past. So not all abdominal or pelvic surgery is going to result in scarring or blockage of the fallopian tubes, but some high risk things could be a ruptured appendix. That sort of inflamed tissue could affect, and the way the body heals, it could affect the function and openness of the fallopian tube. Any sort of ovarian cysts or ovarian torsion, just pelvic surgery, abdominal surgery, especially if it's associated with infection or surgery around the fallopian tubes, that makes me think of tubal factor infertility. And I'd want people to get checkup sooner rather than later. And red flag number 5, I talk about this in so many of my videos. If you have irregular and unpredictable menstrual cycles, do not stop past go. You go straight to your doctor to get some hormone testing and anatomy testing. If you have irregular and unpredictable menstrual cycles, then you are having irregular and unpredictable ovulation. I've seen people who only get 2 or 3 periods in a year, but they waited an entire year to get an evaluation to figure things out because they thought, well, that's what I thought. That's what I read online. You're supposed to try for a year. That person that only had a period 2 or 3 times a year, they only had 2 or 3 tries in that year. It's not the same thing as having regular, predictable monthly ovulation and periods. So if your periods are unpredictable, don't wait. Get testing and advice soon. Topic number 4, when to think about fertility testing and which tests to get. Well, I don't think anybody has to wait to get fertility testing. The textbooks will tell you if you have regular, predictable cycles, try for a year because at least 80% of people will conceive within that first year. But if you haven't, then you should get testing. Or they'll also add a caveat that if the eggs are 35 years or older, try for about 6 months. But if you haven't gotten pregnant within 6 months, then get testing. I understand that. I love the positivity of thinking that people are going to conceive within that year of trying, but I really don't want people to wait too long and then look back and say, man, I was really ready to be a parent, a year ago. And now we found out that we have a really low sperm count or the fallopian tubes are blocked. So I personally don't think anybody should wait for fertility testing, but I also understand it makes a ton of sense for you to try for a little while because it would be so great to not do fertility testing because you got pregnant and had a baby. But things that I think of are blood tests, looking for hormone levels, egg supply. I think about anatomy testing, making sure the fallopian tubes are open, doing an ultrasound to look at the ovaries and an antral follicle count. And then, of course, a semen analysis. Now, listen, I have a lot of videos here on fertility testing, explaining AMH, explaining how to interpret a semen analysis. Fertility checkup is all about making sure there's sperm, making sure there's eggs, making sure someone's ovulating, and making sure the anatomy is okay. Reasons to get testing sooner are all the things that we talked about in our previous topic, kind of chronic medical conditions, irregular cycles. I also think if your family goals are larger than one child and you're in your mid to late 30s, really think about getting testing sooner because you just don't want to waste that precious time. And topic number 5, some tips for when you are starting to try. There's 5 main things that I think about. Number 1 is when to stop birth control. Listen, you do not need a washout period from birth control pills. The main reason I think people might want to stop their pills sooner than when they actually want to get pregnant is sometimes it can unmask irregular and unpredictable cycles. So sometimes people have been on pills for decades and they think that they have regular periods because the bleed that you get with the placebo pills, the sugar pills, in a pack of birth control pills is really just a shedding of the lining. It's not really your body ovulating and then having a period. And so sometimes people think, oh, I have regular cycles, but really they've just been on the pill and getting cycles from the pill. And so sometimes when you stop the pill, if you're not having regular cycles, then you could figure that out sooner rather than later and figure out if there's a reason to kind of get testing sooner rather than later. I have a whole video here on when to stop different birth control methods, like getting an IUD out. I mean, there are people who get an IUD out and they ovulate before they even get a period. So you don't want to completely stop all birth control methods before you're ready to get pregnant, but you might want to stop different ones a little bit sooner. Another example is the Depo-Provera shot. That's a shot that lasts for about 3 months. It's kind of a big bolus of progesterone that lasts for a long time. It can take 6 months or more for that to completely get out of your system and allow your body to start ovulating again. So if you're on one of these long form hormonal contraception methods and you really want to start trying to have your family, think about the method that you're using and think about like, when do you actually want to get pregnant? And I hope that that video with a lot more details is really helpful. Number 2, I think it's really important to understand your cycle. You have got to understand what a typical menstrual cycle is for you. Less than 25% of people actually have a 28-day cycle. That just fits very neatly on our calendar of 7 days in a week and 4 weeks in a month. But a lot of people regularly have 26-day cycles or 31-day cycles. But I think it makes a lot of sense to get to know your cycle and kind of learn what's normal for you. Look for signs of ovulation, increased cervical mucus, changes in libido, energy levels, and things like that in the middle of your cycle. Even doing ovulation predictor kits, learning your cycle will make it when you are actually ready to get pregnant. You're going to know when to try. You're going to know a lot more about your body. Number 3, understanding the fertile window. This is the 6 days leading up to and including ovulation when trying to conceive is your most ideal. And just understanding your body is going to be so, so helpful and help you get pregnant sooner. Number 4, lifestyle modification. Think about some habits that you should stop, like smoking, vaping, heavy alcohol use, and regular marijuana use. I have videos on all of these different topics because I really want to make sure you understand, but think about some habits you should stop and think about healthy habits that you can focus on. Less processed food, moving your body, focused on sleep, managing stress. All of these things are really important because the healthier you are, the sooner you'll be able to get pregnant within reason. In every video that I talk about with lifestyle optimization in my playlist here on YouTube, I talk about the 80% plan. 80% of the time, if you can have non-processed foods, limit alcohol intake, get good sleep, then, that doesn't mean eliminating everything you enjoy. It's just the majority of the time, make the best choices for you. And finally, number 5, take a prenatal vitamin. I think that that is important. If you are taking a prenatal vitamin for up to 3 months before you actually conceive, there's studies that show lower pregnancy poor outcome risk. If you're taking a prenatal vitamin leading up to getting pregnant for about a month, it decreases your risk of having nausea and vomiting or morning sickness in pregnancy. That's like the best motivator I can get my patients to take a prenatal vitamin. The folic acid in a prenatal vitamin will decrease your risk of neural tube defects. Iron helps decreases the risk of anemia. Vitamin D is helpful for your reproductive health and your immune health. There's so many good things. I've got videos here on how to find the best prenatal essential vitamin for you. And I've got another video here that helps you find safer supplements because they are all definitely not created equally. And finally, a part of lifestyle optimization is decreasing exposure to everyday toxins and endocrine disruptors that can impact egg quality, sperm quality, miscarriage risk, and overall pregnancy outcomes. This is something that people can get really nervous about and really upset about. I don't want it to be that, but just really nice, kind of easy changes, decreasing plastic in your kitchen, not heating up food in plastic. You get takeout and kind of get the food out of the takeout containers. Those are really great things you can do, trying to use a glass or stainless steel water bottle as opposed to plastic. Thinking about some of the products that you're using every single day, your makeup, your shampoo, your laundry detergent. This shouldn't be something drastic that you have to overly worry about. There's certain products that I love that may not be absolutely perfect, but when I have something like laundry detergent, I'm finishing it up. I think, well, let me check on this safety and see if there's an alternative that might expose me to less chemicals. Something to think about. I'm glad you stuck around to the end because I do want to talk briefly about the option of using IVF as a family building strategy. It is not for everyone, but certainly if someone is starting their family in their late 30s or early 40s and they really want to have at least 2 kids, maybe 3, it's something to really consider because I know we think about egg freezing as a way to preserve fertility. The message is out that the older the eggs are, the harder it is to get pregnant. So you can freeze your eggs when you're young and then use them when you're ready to start your family later in life. But I can think about embryo banking or doing IVF as a way to get pregnant soon. Now it's the highest success rate of a treatment option that we have. And then having embryos frozen to use later to add to your family. This is absolutely not for everyone, but I just don't think that people realize that that can be a benefit of IVF. I think a lot of people think of IVF or in vitro fertilization as a last resort and only to use if people, have struggled for years with fertility. I don't think about it that way. I think about it as an option. I think about there can be pros and cons. Certainly, if people don't need IVF, I want them to try without it. But if your family goals and age are colliding, it's something to think about and just get a consult and a little bit of information to see if it's right for you. So let's recap. Age and fertility is a big deal. Age 35 does not mean that all your eggs are going to shrivel up and you're going to be infertile or that you have to do IVF. But there is a big impact on age and fertility, especially with eggs compared to sperm. And so it's important to understand fertility in your 30s, know what your risks of being infertile are, think about optimizing your health, look at your lifestyle optimization, think about your family goals, and think about testing sooner rather than later. I really hope that this video helps you. Like this video if you learned something, comment with questions that you have, subscribe to this channel so you get my weekly videos all about reproductive health. And until next week, wishing you love, luck, and pineapples.